if you are at risk for heart disease and having symptoms that could be a risk for, say, a heart attack, or having symptoms that could be suggestive of having a stroke, these things absolutely need urgent medical attention. And the risk of leaving the home at that point is minimal compared to the risk of not seeking care when it's needed for very urgent or emergent situations. The emergency departments are designed in a very distinct way to be able to safely take care of patients without COVID-19 and prevent them from being exposed while they're there. And for that reason, it is absolutely essential that very treatable conditions that could be very serious, should not be delayed even in the setting of the stay-at-home orders.
It's important to take care of yourself, and if there are symptoms that would make you go to the emergency room, there are still some very important things that need to be done to maintain your health. And so going to your physician as the stay-at-home orders begin to be relaxed, I think more and more practices will start encouraging those kinds of visits. We here at the health center at the very beginning certainly were not doing a lot of routine care because it was more important to really shelter in place. But we can't do that forever. And we really, staying in place and not taking care of some of the real important maintenance visits that are necessary, especially for children, can in the long term create more problems. So, we talk a lot about, are we ever going to have a vaccine for COVID? And there are a lot of vaccines that are available for a lot of other illnesses and diseases that we need to stay on track for, because if we don't, those kinds of illnesses will come back. And so what I would suggest at this point is that certainly if your child is due for a well check, including immunizations, to call your pediatrician's office, find out how they are handling those types of requests. There have been lots of things that I've seen different practices do that have been very creative. There have been some vaccination vans that have been going around to communities, again, to be sure that these immunizations, which are so important, are being done.
In the foreseeable future, there's likely going to be a need for wearing masks when we do come to our own healthcare providers' offices, that the masks that we would wear as patients coming in would be an anticipation that we'll see in much of society over the next several months, of when you're going out in public, that the mask wearing recommendations that are currently in place do also apply for when visiting the doctor's offices or even the emergency department.
Many practices are looking at the way they schedule their patients. And this has been long held in pediatrics, that routine healthy visits tend to be set for the morning, the sicker visits in the afternoon. And, every medical practice is very aware of people's concerns and are really taking every measure possible to be sure that we're providing care that is very safe to everyone coming in.
In general, to minimize the number of people that you're bringing as a visitor with you. So say if you're bringing a child to the pediatrician, try as much as possible to just be one parent bringing the child, and perhaps only that child itself without siblings, to, again, minimize the numbers of people in the same, congregating in the same, say, waiting room. And certain offices may actually have policies on that you would want to check with ahead of time.
Certainly for routine visits or a visit to your pediatrician's office for any reason is to call first, find out when and how they're going to handle that particular visit. But because certainly we all want to keep everyone safe.
And also to remain safe, I think it's just like going to the grocery store, to the pharmacy. I think heading to the physician's office also would be an important time to use hand hygiene after leaving. And if you have some, for example, in your vehicle, or if you drove to the appointment, or have some that you can carry with you. Using like a hand sanitizer immediately upon leaving the office setting would be always recommended.
And these are really simple things that we can do and that everyone can do, but they're so important right now to keep us safe.